All right, good morning, everyone. And thank you for joining us this morning for this session. My name is Dr. Sivuyile Madikana, and I'm delighted to be moderating this session this morning. Now, the world has made incredible strides when it comes to eradicating deadly disease. As an example, since 1974, over 154 million people have been saved due to the expanded access to vaccines. Polio eradication has reduced by at least 99% due to the eradication program since the 1980s. However, we're at a turning point at this point in time where we are seeing global aid cuts, economic upheaval, and also political as well. And so the question is, how do we adapt our advocacy, our global initiatives in terms of adapting to this new environment? Luckily, this morning, I have two incredible people with me on the panel, Gargee and Ramesh, in order for us to answer these questions. And Gargee, welcome. I'll start with you, right? How are you and the Gates Foundation thinking around your philanthropic partnerships, especially in terms of innovating for global healthcare delivery, but also catalyzing, engagements with the government, considering all the shocks that we've experienced in the world?
Thank you. It's great to be here. Thank you all for caring enough to be here today and show your support. Just to ground our conversation in polio, when the Global Polio Eradication Initiative started in, I think, 1998, thereabouts, there were 1,000 children a day being paralyzed from polio in 125 countries. And last year, we were down to hundreds in a year. We've gone much below that. We haven't gone much higher than that. Endemic in only 2 countries. And I start there to say we have made incredible progress. It has been an incredible few years, few decades of innovation and just diligent, dogged public health work, with heroes out vaccinating in the farthest corners of the world. That is particularly important for us now because in many places, the work we do, whether it's public health or development, is being challenged, it's being diminished. And the number one thing we're thinking about at Gates is how do we stand up for the great work that needs to continue? How do we fund it, put our dollars where our mouth is, and how do we talk about it and defend the institutions, the causes that we believe are still just as important today? We've just announced our continued commitment to the Global Fund. We'll contribute $912 million over the next cycle. We continue to support the Polio Eradication Initiative, Gavi. But the second thing is exactly what you're asking. How do we evolve? How do we evolve the system and not just put our heads in the sand and suggest that everything can go on as it was? It's partly about aid cuts, but it's also about how do you use new technology in the most efficient way. We were talking about digital transformation in the green room. It's also about how do you work with countries who want to be in the driver's seat of their own health differently. So all of that, I think, is leading to some painful adaptations where it's kind of cost-driven, but also some creative thinking about how we get more efficient and effective in all the work we do. The Polio Eradication Initiative is strengthening lab capacity on the African continent to do a lot of the diagnostic and surveillance work that is going to need to get done. That's a good thing. How we bring AI-enabled healthcare to reach millions more where the health system doesn't yet go, that's going to be a good thing. So we're trying to both be proud of what needs to continue to get funded and be adaptive and creative about how we keep the work going.
No, fantastic. And I mean, it's really around the innovation that you and the foundation are putting forward. Ramesh, I want to turn to you. Now, for those who don't know, Ramesh is the only person to have hand-cycled across Canada. An incredible 7,000 kilometers, right? And you did this back in 2008, and since then you've done a lot of work in terms of engaging with governments, healthcare organizations, in terms of advocacy for a polio-free world. And really the question to you is, how do you think, advocacy at this point in time needs to adapt in terms of the changes that we are seeing in the world at the moment?
Thank you. It's an honor to be here, and thanks for the question. In 2008, I hand cycled 7,140 kilometers, and I say the conversion to miles, that's a lot of miles. But what kept me going, what fueled me, was knowing that there's so many healthcare workers that are risking their lives every day providing vaccines to children, and the 1.3 million Rotarians that are committed to a polio-free world, and the polio survivors that I've met crawling on the streets. That's what fueled me to go across the country, and I never gave up, and I will never give up moving forward. We do have some political headwinds right now with reduced funding and support for the polio eradication efforts. Countries not prioritizing vaccines, and the answer to this is that as advocates, we need to keep moving forward. We don't give up. We move forward stronger, and we have to be using storytelling as a way of educating decision makers about the importance of funding the Global Polio Eradication Initiative and ensuring vaccine equity for children everywhere, no matter where they live. It's important that as global citizens, we are taking the time to raise our voices. Your words matter, they make a difference, and I encourage and implore all of you to ensure that you're raising your voices so that our decision makers can hear the call to action that we cannot give up in the fight against polio and ensure vaccine equity for children everywhere.
Thanks, Ramesh. Gargee, on the global eradication, Global Polio Eradication Initiative, just to touch on that point that Ramesh made, the Gates Foundation has long supported that initiative, and Bill Gates earlier on this year announced a 20-year plan to almost sunset the foundation's initiatives, and one of them being polio eradication within the next 20 years. What new strategies do you believe the GPEI needs to be utilizing in terms of achieving this within this time frame?
Yes, thank you for that, and I hope Ramesh will add as well. So first of all, we did announce earlier this year that two things, that Mr. Gates would contribute his fortune to the causes of the foundation. And second, that we would do as much as we could in 20 years and then close our doors. And the idea there was to really signal an acceleration. The close we will need to be thoughtful about. We will need to be thoughtful about how we bring other partners along to continue the work after us. But the point was really to say we're going to accelerate now because so much good can be done. And it's in that vein that I think your question comes. First of all, just to say, polio eradication better be done a lot sooner than that 20 years. So that is not one of the ones I want us to be thinking about closing on our last day. Maybe we can talk about how soon that is, but it is much sooner than that. Now, how are we going to get there? As I was saying before, I think a lot of the story of progress on polio is actually a story of persistence. And it is one of careful surveillance of wastewater, careful outreach to communities, of engaging healthcare workers again and again. So this is not a place where I even want to suggest there's a magic something or other. This is really about careful work. And where we are now is polio remains in the hardest, most vulnerable population, hardest to reach, most vulnerable populations. 2 endemic countries, Afghanistan and Pakistan. This is not just about making the product. This is about how you're thoughtful about reaching communities. Now, that's not to say the program can get there without being innovative. They are absolutely thinking about how to make product go further in a finance-scarce environment. They are thinking about how to get creative in using singers, Bollywood stars, to spread the word on vaccine safety or access days. So there's a lot of creativity I see in how the program is thinking about this last mile challenge. We're also trying to be creative in how we partner with philanthropy at the kind of global fundraising level. But it is really the persistence of Rotarians. It is the persistence of the vaccine workers that's going to get this story over the finish line.
Thanks, Gargee. Ramesh, to you, just on the advocacy work, I mean, earlier on this year, you were in Australia with Rotary International and Global Citizen, meeting with politicians, the Minister of International Development. A question around that is, how do you enter these conversations, with especially the wealthier countries, specifically thinking around the global aid cuts that we're seeing, and what do you take away from those conversations?
Yeah, so I had an opportunity to meet with Australian leaders and just to remind them about how important their decisions are in our efforts to end polio, and that never is the time to go backwards. We need to have consistent funding in order to vaccinate children. And I just reinforced that there is a team of global citizens and a global community that want a polio-free world. And in order to do that, we need countries like Australia and other developed countries to be funding generously, not clawing back, the Global Polio Eradication Initiative. I say that I use my body as a tool to message what can happen when one doesn't have access to the polio vaccine. And I reminded Australian leaders that my legs are paralyzed by polio because I contracted it 25 years after the release of Dr. Jonas Salk's 1955 polio vaccine. And we have an opportunity to eradicate polio once and for all. And in order to do that, we need decision makers to be funding the polio eradication initiative. And so I just reinforced that. And as an advocate, it's important that we don't just allow politicians just to make commitments. We have to make sure that they're accountable and they deliver on their promises. So I'll definitely be following up with all the leaders that I can meet to ensure that they're delivering on their promises. And I encourage all of you as fellow advocates to do the same.
Ramesh, thank you. Thank you for the work that you do. Gargee, my last question to you, and I think we've got about 1 minute left, and it's touching on a point you made earlier on around eradication. I mean, Nigeria in 2020 was sort of the last African country to eradicate polio, right? However, of late we've seen a variant of polio strains coming out, and so the question is, what do you think we need to be doing differently in terms of encouraging international partners and what they need to do differently from a strategy perspective to continue a polio-free world?
Thank you. 1 minute, huh? Look, we do have a situation now where we've got endemic wild polio to 2 places, but we have to stay on top of vaccination and effective vaccination because there is still polio circulating. So one of the most important messages talking about storytelling we have to figure out how to keep delivering is that now is not the time to stop vaccinating children. We do need to continue, even when we say a place has been declared polio-free, we actually still, people understandably then say, okay, maybe we can stop vaccinating. We're not there yet. So we are continuing to make advances in the vaccines themselves to make them more and more efficacious, and we need people to keep building polio vaccines into their immunization programs. I will just say a broader point that we we are also putting more energy into reassuring moms and families about the safety of vaccines. That's becoming more important, and I'm making a global point, could be true in many places, but we know the safety, certainly, of the polio vaccine. We understand that very well, and we're having to work with pediatric associations, nurse and midwife associations, to just reassure parents that this is the right thing and the right choice for their children.
No, absolutely. I think we'll stop right there. Thank you so much for the incredible work that you both do. I think the key takeaway message here for me is we need to continue the work that needs to get done in order to achieve a polio-free world. And to the audience, if you haven't done so yet, please check out the polio virtual booth downstairs, as well as you can log on to globalcitizens.org and pledge your support in terms of eradicating polio. And yeah, thank you so much for joining us.
Thank you.